We certainly are very active in the field in terms of clinical trials. We think it's important to make available these emerging therapies that otherwise would not be accessible, but it's very much a patient-specific decision and shared decision-making between the patient and the provider as to whether that's an appropriate choice. So there may be a situation where we may say, oh yes, we've got various clinical trials, but that's not something we recommend for you, or we know that the logistical constraints make that pretty difficult, if not impossible, to participate, and that's okay. So we have to consider that for each individual patient.
I think just to echo some of what Dr. O said, clinical trials participation, I think, is very individualized because, every patient is different. And so you have to choose for yourself, kind of what fits best. But in regards to, why we think clinical trials, or why I think clinical trials are so important, is because we definitely, I would say, in regards to treatment for all of our MPN patients, we can do better, than what we currently have.